the food that we eat every day plays a meaningful role in either making our health optimal or suboptimal. And I think that's something that's obvious for people when you say it in that way at a very high level. But there's just a large disconnect between what we're actually doing in terms of providing healthy food, optimizing health outcomes based off of healthy food, and what we're doing in the healthcare system, which is generally focused on acute care and is focused on disease. And so what we see happening, in part because of economic changes and trends with the self-insured, in part because demographic changes and incidence of disease of inflammation and chronic health problems, and in part because of the tools that we have to show, not that healthy food is healthy, but certain foods are specifically impactful in specific ways, because I think that's the level of rigor that you need in the healthcare community. All of those things are starting to come together now. And we see those two systems, which were disparate systems in the past, as converging, because food is another input into the healthcare system. It's another input into human health outcomes. And it's not just food, it's specific food ingredients. It's specific customs, it's specific types of access, and all of those things with specific information that lead to specific outcomes. And so I think it's really food is coming that way into the healthcare system, and that's the convergence we see, and that will impact human health in a positive way. It's going to change some of the channel dynamics and the way that we provide healthcare, the way that we pay for healthcare, and I think the way that we calculate the cost of healthcare and the cost and reasons for suboptimal healthcare outcomes. As you look at the cost of the healthcare system and what some of those costs are spent on, we're spending $13,000 a person on healthcare in the US. That's $4.5 trillion. You look at things like diabetes, we spend over $350 billion a year on things like diabetes. Estimates are $50 to $70 plus billion are spent on the side effects or the negative impacts of unhealthy eating. Hundreds of billions of dollars are spent on diseases of inflammation. And these are diseases that in material part can be impacted, or their human health impact and economic cost can be reduced significantly with a healthy approach to nutrition. And we're invested in a host of companies that either help provide access, provide education, or in some cases provide food-based therapeutics that themselves can mitigate some of the negative impacts of these diseases of inflammation. As we have a population that is aging, as we move toward a population with chronic needs, and we have a medical system that still is focused predominantly on acute care, we need those ongoing or chronic solutions, if you will. And they're habit-based. We obviously, everybody knows about sort of smoking cessation programs and some of these, exercise-based programs that a lot of employers provide and get certain incentives to provide. We see the next wave is nutrition. If you look at Medicare Advantage, I believe it's upwards of 40-something% of those programs already include some sort of nutrition-based aspect. And we see that as something that will grow and continue in the future. We're investing in companies that either provide that nutrition, and that can be in the form of delivering healthy meals consistently. It can be companies that have specific interventions, and maybe that is understanding that actually these macros that you're taking in, they have some micronutrient that has a therapeutic benefit. You should be taking those. You should just understand what's in the food that you're eating. Or perhaps we found something in the foods that we eat or in the microbiome of the foods that we eat, and that thing that we found has a therapeutic benefit, and we should bring those forward as a drug. A lot of times it's about access, it's about education, and there are many other factors that go into why people might have a suboptimal diet. But we can look at the bucket of diet, which is just the ongoing approach to nutrition. And companies that can optimize that nutrition should be able to achieve to pull certain healthcare dollars, because they should be able to generate certain healthcare savings in the future. And on the other side, there are those things that are therapeutics. And I think we're finding a lot of actives and things with therapeutic potential that come from the food system or come from ingredients or the agricultural system and agricultural commodities. And I think those will meet the existing standard of the medical community and also be able to capture some of that value as a healthcare product. And we have a system where I think it's upwards of 70% of large corporations have some form of self-insured health insurance. I think 60% of people work at organizations where they are on a self-insured plan. And when you have things like self-insurance, you have the cost of negative healthcare outcomes being borne in part by the employer. And so there are incentives to optimize healthcare outcomes, because if you don't, you're going to have to pay those costs ultimately. And that speaks nothing of the actual health impact that we're seeing with, less than optimal eating habits and access to healthy food and access to healthy, ongoing innovations. And so if you think about the massive costs and who's paying those costs, where historically those were things that were borne by, maybe government programs or passed to something or some other entity, those costs are being absorbed by people with a real incentive to mitigate those costs. And that's where the economic incentive is.